right next to Sylvia. Okay. Welcome to what we're calling the future of healthcare in Imperial County. This is a roundtable discussion. This is intended to be able to have these representatives of different aspects of our healthcare have a conversation about what the pressures are today and how we can resolve that for the future, and maybe come to a consensus today on a plan that we can take into tasks outside of this meeting to go forward. So you have been invited to be witnesses of this conversation. This roundtable is to have this debate and discuss different plans and options to what the pressures are today. And there will be an opportunity for you to submit questions. I know that we are getting question cards, and those will be referred to the specific agencies to give an answer. But I am asking that all those in attendance, that you refrain from any outbursts and that you stay engaged in what the conversation is at this table as we go into some of the things that are being dealt with today and in the near future. So putting that in place, I also want to share that my name is Ryan Kelly. I'm the chair of the Board of Supervisors for this year, and I'm joined by Supervisor Luis Plancarte. We will be moderating this meeting, and the reason that we asked for this is because of the precipice that we're experiencing, not just with El Centro Regional, but also with Pioneers Memorial. The two facilities, the two agencies are, well, we've come to the realization that that one system serves our community in a better fashion. And how we get there, I know that there's been multiple attempts in the past, but we want to talk about what we can do to move in that direction. I also want to thank IVC for making this venue possible. We've been fortunate to be able to use this for other events, but this one at such short notice, I'm extremely thankful for that opportunity. And then also for all these panel members that have that interest for our community, that they want to be involved in this conversation and help craft a solution. So I am still very hopeful as this begins that by the end of this we may have agreed tasks that, and maybe even an outlook that we can move forward. But we will be hearing a few different options, and we'll be able to discuss those. So I'll just share with you that for my own history, I did work at El Centro Regional. I know the people there. I still have friends that work at El Centro Regional, and I care about that, those people and the others that are employed there. I currently work at Pioneers, and I care about their livelihood and the success of that agency as well. So in a neighborhood of 1,800 positions between the two facilities in this county, it is one of the largest employment sectors of this valley, and it has a significant impact on the overall economic health of Imperial County. I also was a fireman, so I also know how to recognize an emergency, and this is an emergency. So with that, that's who I am, and I will ask each one of the panel members to give a brief introduction. Stress is on brief, so that everyone in the audience knows your background and where you're coming from. Sure. So, Mr. Walls?
Sure. Hello, my name is Brandon Walls, Director of Operations for American Medical Response. I'm a paramedic, and I've been a paramedic for 20 years. I'm happy to be here. Thanks.
Good morning, everyone. My name is Jeanette Angulo. I'm the Imperial County Public Health Director. I've been with the Public Health Department for close to 20 years.
Good morning. I'm Dr. Kathleen Lang, a longtime Valley resident and currently Vice President Regional Medi-Cal Lead for California Health and Wellness, serving more than 80,000 members of this community.
Good morning. My name is Dr. Carlos Ramirez. I am the Chief Nursing Officer and Chief Operational Officer for Unicare Home Health, Hospice, and Private Care. I'm also a Commissioner for the Local Health Authority. Been in the Valley for 35 years, and I'm also a registered nurse.
Good morning. My name is Katie Alcantara Santillan, currently President of the Board for Pioneers Memorial Healthcare District. I have been in the Valley for a little 50-plus years. That's just giving you a hint, so you won't know my age at this point, but you can tell. But anyway, I'm here to help in whatever we can, and thank you for coming.
Good morning. My name is Sylvia Burnell. I'm with the Heffernan Memorial Healthcare District. I've been there for over 16 years, and I'm the VP for Heffernan, and it's a pleasure to be here.
Good morning, everyone. My name is Tomas Oliva. I serve as the chair for El Centro Regional Medical Center. I get to sit here, but I just want to highlight some folks that are here with me also. Edgar Garcia, Martha Cardenas Singh, Sylvia Marroquin. We have our city manager, Cedric Cesenia. We also have ECRMC staff, Scott Phillips back there, Suzanne Martinez. So we're all here. I just get to sit up here, and it's a pleasure to be part of this conversation.
Good morning, everyone. My name is Dr. Thieng Vo. I'm an internal medicine doctor, and I'm also the CEO of a Vo Medical Center. We serve the patients from Calexico, El Centro, and Brawley. I'm happy to be here, and thank you.
Good morning, everybody. My name is Mohammed Al-Jassim. I am an infectious disease physician and wound care. I am the immediate past chief of staff for El Centro Regional, and I served 2 terms as assistant chief of staff. I've been in the Valley for the past 18 years.
Good morning, everyone. I'm Dr. Hamid Zadeh. I'm the president of the current local California Medical Association. I'm also the chief of obstetric department for El Centro Regional Medical Center. I've been here for the past 13 years.
My name is Dr. Robles, Jorge Robles. I'm actually a private practice doctor in family medicine and internal medicine. I do private practice and also participate in the hospital on multiple levels. Currently, I'm the chair of outpatient services for ECRMC. We have 2 fabulous clinics, both in Calexico and El Centro. Has been serving this community for 27 years. I'm also the president for our group, Imperial Valley Family Care Medical Group. I also participate in the Imperial County Medical Society since its foundation, now led by Dr. Zadeh. And also, I was one of the first doctors that participated in the Imperial Valley Health Authority that we now have more full-time organized. Very happy to be here, representing the opinion of many of our organizations, and hopefully I can contribute to your questions, concerns, and plans, proposals.
Good morning, everybody. Thank you for taking time out of your Saturdays. I am Luis Plancarte, supervisor for Imperial County, elected by the residents of the 2nd District, which is the southern half, if you will, of Imperial County, the southwestern half. However, we do represent every citizen in Imperial County once elected. So on behalf of the County Board of Supervisors, on behalf of every resident in Imperial County, I thank you for showing up. I ask you to be present. I ask you that you participate in the frame of mind of looking forward. How are we going to move forward with what we have? There is no doubt in my mind that with this kind of horsepower in this room, we're going to come out with some great ideas, and we're going to walk out with some great solutions this morning. So having said that, let's get to it.
Thank you, Luis. I also want to recognize Supervisor John Hawk is also here in attendance. And before we get any farther, so that we also have representation from the Assembly Office and from the State Senator. So I know that there will be plenty of criticism to come. I just want you to know that my mom dropped me a lot on my head. Okay? But she didn't drop me that many times, so I know a few things. So I wanted to frame this into what we know, the current conditions. So our population is about 180,000. We are HPSA designated. In Calexico, it's at the rate at 19, and El Centro, it's at 15. We're 4,000 plus patients per provider, so we have a disadvantage on having the amount of medical professional physicians in primary care to our population. Our population is also influenced directly by being adjacent to Mexicali, Mexico, and so we see an influx of service use by the population that comes across for service. And so that can number between 300 to 400,000 in an annual year of population mix in Imperial County. We also, and as we have Carlos here and also Kathleen, we have a very high number of people that are on Medi-Cal and Medicare. So the two combined, over 50% of our population is public insurance. And then I believe, and they'll correct me, I believe it's over 46% is Medi-Cal specific in Imperial County. More, okay. That was 2019, so I guess those numbers continue to rise. I remember the days when we only had 20 registered in Medi-Cal, right? Or 20,000. So we have compelling challenges right now in the hospital, and so not to miss this, each hospital is facing economic hardship at the moment. So they're taking measures, cost control measures, trying to be more. Can you not hear me, Tom?
No, I'm hearing him here, and I'll bet you there's others that are.
All right, I'll come closer to you. Okay. All right, so both hospitals are facing economic hardship and they're doing cost controls, but the pay mix in this valley is challenging because the cost of services, salary, supplies, and seismic compliance is very burdensome on the system. And with the reimbursement rate and the cost recovery, it is becoming more and more challenging to operate two facilities in this county with not having the efficiencies of scale. And so that, and as we mentioned, the Medi-Cal recipient population and the lack of increases of that payment back to our services, and I believe it's over a decade since they've seen the significant rate increase. So putting that in context, we are now going to jump into what could be where we find consensus. So there are proposals that are being considered to try to move forward and deal with what is happening right now in El Centro, and then also how it could be for the entire county. And so I don't know if Mr. Oliva is ready, but would you be free to share the proposal that El Centro is considering at the moment?
Sure. All right. So the proposal that at least has a nod from the Board of Trustees of El Centro Regional Medical Center is the following. It's a little controversial, mainly because it challenges the concept of we and them to us, right? It's no more the South, El Centro, North End, it's all of us, right? So the the concept here, it would be legislation introduced in Sacramento that would create one healthcare district, right? So it would be one healthcare district encompassing of the two campuses. So it's a two campus, one flag concept. We would be under the same system, which would mean we would have just one management oversight, right? One CEO, one CFO, one chief nursing officer, medical officer. And the second part of that would be one taxing increment, property tax increment, onto the entire portion of whatever's in that district, right? So let me pause 1 second and just say there are tiers to this, meaning the most ideal would be that this one healthcare district encompass all of Imperial County, meaning the portions of Heffernan, the portions of Pioneers, and everything else outside of it, remembering that El Centro Regional is not a healthcare district, right? So it would be all of it. Now, if one entity decides not to be a part of that, then it starts watering down, right? It starts coming less and less, I think, ideal in terms of its success. So the tax increment, keeping in mind, Heffernan already imposes a tax increment within their district. So theoretically, those residents wouldn't see an increase because it's already happening. The same thing with Pioneers. There's already a tax increment that's imposed on property there too. So for that portion, theoretically, they wouldn't see an increase. Where you would see an increase is if you happen to live in Imperial, El Centro, Heber, Hopeville, Sealy, Ocotillo, right? Anything that's currently not within a district. So the reason for this is because now we would all be paying into this new system that's all encompassing of Imperial County. There would be kind of like IID in the sense that this new healthcare district would be governed by a board, and that board would be elected by the people, right? There will be districts, right? People will elect that portion of it. The third part is where we would request a loan, low interest loan from the state, and that would pay off the bond as well as take out some money that is probably necessary to do seismic retrofit for the buildings of Pioneers. And how we pay that back would be this tax increment that goes in. And once we're collected, we would have a higher rate of reimbursement from Medi-Cal, Medicare. All right. Yes. Did we forget to make silence is golden in the beginning?
We're going to end up having Saturday detention and they keep.
So roughly, for me to stop talking, that's essentially the plan, right? It's creating a new healthcare district, having a tax increment, and requesting a loan from the state to pay off the bonds as well as to do those improvements for buildings that are now within the system, right? And then we would pay it back through this tax increment. And rather than owing bond holders, we would be owing the state. So that's it.
Thank you, Mr. Oliva. So, Ms. Santillan, there was also a proposal that was shared by Pioneers, and it's in majority consistent with Mr. Oliva's announcement. And there's some nuances there, but the Pioneers board took action this past week. Could you share that with the public?
Yes, on Tuesday, the 24th, Pioneers Memorial Hospital Healthcare District passed a resolution to expand the district to all the county. And we would actually be doing the same thing that Mr. Oliva would be doing, but the district is already there. So we don't have to create it, we just have to expand it. And the same thing of asking the assessment for the whole county would be the same thing, and asking for money to retrofit, and to also be able to expand the services that we need to have with one district. And this include, we would like to have, because Calexico is already a district, and we had passed this avenue a couple of years ago. I was in that strategic with El Centro. It'd be good to bring it up again and be able to work with one healthcare facility and be able to help the whole community and be able to provide the health care that we need, because we're not getting it right now. We're duplicating services. And having to eliminate all these services, like Mr. Oliva said, is what we need here right now. And the district is already there. We don't have to create a district. Legislation doesn't have to come in at this point. And we don't have to ask for any loans to pay anything that we have in debt right now at this point. It's just monies to ask to be able to expand and be able to at least do our retrofitting that we need.
Ms. Santillan, and also in your ask, it's not approaching, it's not affront to Heffernan or to El Centro. It is consultation, and there is the allowance for the reconstitution of the health district to have representation of an expanded district. Is that correct?
Yes, like I said, it's exactly what Mr. Oliva says, that there will be representation in all the district, and we'd like to present this to LAFCO for approval.
Thank you. And Ms. Bernal, how is the Heffernan district viewing, as in the past, what is currently being discussed today?
I can't speak for the rest of the members, but I can tell you that, and Katie, you probably remember this, it's over 10 years that we all met together, the El Centro Regional and Brawley, and we did some meetings in Calexico, hometown meetings that we had, and we were thinking about doing this, what we're talking about right now, but it never came through. But I'm sure that I will take this back to our board, and I'm almost sure that they will approve this. I know that our CO is in favor of this.
Thank you, Ms. Bernal. So there is a piece of these two proposals. There are differences in it, but the overall organization is in unison of where you are today and where they are as well.
If I may, I just wanted to iron out something there, and that is, I think, like you said, the premise of us needing to unify, I think that's where the consensus is, right? In the plan that I was discussing, because we still have, this love for our identity as far as the branding of Pioneers, the branding of El Centro Regional, right? The reason why I was saying of creating one district, this one district wouldn't be named El Centro Regional, and this one district would not be named Pioneers. It would be something inclusive, right? The Imperial Valley Healthcare District, right? But we would keep, right, the Pioneers campus of Imperial Valley Healthcare District, the ECRMC campus of Imperial Valley Healthcare District, right? So I just wanted to make sure that I was
Understood, Mr. Oliva, and I forgot to say that, for you, me, and everyone, our egos and our hometown identities probably needed to stop at the door, but I understood what you're saying. Dr. Vo, now, I don't know if you're willing to share, but do you have designs or a proposal that you could share with us?
Sure. I'm lucky to talk before our colleague right here. Yeah, good morning, everybody here. I'm very humble and honored to be here and share my idea. Actually, the suburb district, I've been talking to the whole valley for the past 5 years already, probably at least 3 years ago, because I saw it's coming, because we all wasted our resource and financial, we are struggling, and we pay double for everything here in the valley. And the hospital, we don't have enough patients. I talk about value-based system as well, because really we don't want to see sick patients every day and make money on them. That's not the goal. So the big cities like San Diego, Orange County, they already go into that trend already, value-based system. That means they pay the state, the county, they pay a lump sum of money, and we provider here sit down here and have a plan to how to treat the patients and make sure they're healthy. They don't come to the hospital, they don't come to the office more often, and that's I think the best way we should go. Statistic-wise, in Orange County, have 45% patients going to managed care, Medicare Advantage, because really they spend time quality with the patients so they don't come to the hospital. And of course, at the end of the day, everybody benefit from it. So go back to our county, we have probably about 120,000 members. It's Medicare and Medi-Cal total. And that's the reimbursement from the state very low. That's why we're struggling, and that's why we really have a problem. So we propose that we form a hospital district to accommodate this. For example, now Heffernan, they have district, Pioneer have also district, and we did that for Coachella, Indio Valley already. It's nothing new to us. So Coachella, they expand all the way to the north to become the district. So they serve everywhere. Here we have three sections right here, and we are not united. But I think after today, we all come together and move forward. The hospital districts will help us to minimize all the costs and supplies, and we can help all the providers come together to form one health plan, one health care, as well as a provider here. We are ready to be involved, ready to work with all the county and the city mayors and managers. We're here not to demand anything, but we're here to offer help.
So, Dr. Vo, is there, in your comments, you're looking at the countywide health plan or health district as the viable choice, right?
Yes.
But do you have a specific proposal that you have already been formulating that you could share for what's currently happening, or are you part of the piece with this path of going towards a countywide health district?
We have, technically we have not many options. One option is that the private entity can buy the whole two hospitals built together. That's one option. And of course, we don't want any loans or any debt for our county. And of course, that's not easy option because we have a lot of liabilities for the hospital, especially the bondholders. We owe $125 million for El Centro. And Pioneer also, we're going to have a problem with, we have to rebuild the hospital in Pioneer as well to comply with the earthquake that in 2020. So those are I think the big issues. Our proposal, actually we had a meeting with Dr. Manny. I think he's the lead for this providers coming together. And we had a meeting, very successful meeting, a productive meeting, that we decided to come, put everything aside, our ego, everything aside. Now it's time to help the community. Not blaming on here and there, but move forward. And Dr. Manny and us sit down and we propose to the point that we agree we're going to sit down and help the hospital. We want to step in if the city council here agree for us to step in to be part of the solution, and that's what we want to do. And of course, we have more details. I don't think we have a time to do here, but we have a lot of details how to make the El Centro Hospital increase the revenue, reduce costs. Of course, that's the key.
So, Dr. Vo, then at this moment, though, there's not an alternative that we would share for this conversation. Okay.
No, yeah, I think I agree with the super district hospital.
So then, from what we've heard from El Centro and from Pioneers, and I'm also heard from Dr. Vo and Ms. Bernal, it seems like we're talking about trying to create a countywide health district. By show of hands, who believes that that is the best path forward from the panel? Okay. So then the next question is, how do you do that based off of what Dr. Vo mentioned is the mounting debt, and I know that's a differential between the two proposals that are being considered at the moment.
Well, I want to make it very clear that the debt was for the seismic retrofit requirements that are put on by the state of California, and so it was done in order to make the buildings compliant, right? Which they are now, and our deadline at El Centro Regional was 2020, right?
Yeah.
Pioneers has a deadline of 2030, which means that their buildings are not compliant, and they will have to take out money in order to make it compliant, right? So,
Right.
So our bill is there, so you could see it. It will come for Pioneers as well, right, respectfully. And so that's why we can all agree to be one district so that we could better sustain
Right.
those outstanding debts, but also to have a district that can meet the needs of the future, right? So where there's monies where we can improve, modernize equipment, right, upgrade, all that kind of stuff. Because
So,
right now, we
Mr.
can't do that.
Oliva, I understand that part, and where I'm getting to is, I think we can chalk that all up, that everyone is in unison, that a countywide health district serves the public
Right.
and the overall health medical services to the advantage of our citizens. The part is, how do we cook this to be able to have something we're going to be able to eat? And I'll turn it over to Supervisor Plancarte, because I'd like to hear what the panel believes that we could do to be able to, as Mr. Oliva mentioned, the seismic compliance for El Centro Regional, those building projects were to take care of required spaces to be in seismically performing buildings by January 1st of 2020. It is now 2023. So you've had an agreement with the state to be able to continue to use those spaces that were not over that time. And Pioneers is on a timeline of January 1st, 2030 to be able to replace its med-surg, its pediatrics, and the support areas that are in non-seismically compliant buildings. And that is going to be a price tag in the near future. So I ask, Dr. Robles, your comments.
Yeah, just real quick, I want to throw two ideas. I'm very pleased that the public is involved, as we see a great turnout today of talented people, citizens, experts in healthcare sitting here. I do want to say that I'm very thankful and nicely surprised that the county has decided to get involved in trying to bring a solution, a platform, a place when we can all talk. I want to mention as well that both hospitals, I just want to remind the public, and for the record, that both hospitals has really done an incredible job in coping with carrying on the healthcare needs of the valley. I want to applaud the nurses and the doctors that have gone out of their way. One moment we'll take to remember that at one time we were a national hotspot for COVID-19. And much of the situation, both financial and shortcomings on both nurses and doctors, have come from that crisis that's facing our county and our nation. El Centro Regional Medical Center and Pioneers both have done a tremendous job doing that, with very little, actually, particularly at the beginning where we did not have the knowledge, the tools, the meds, and the facilities to take care of so many patients. I can testify for so many people that with tears went in a room to take care of patients with the fear of getting contagious and sick. So I just want to say those two things. The third thing was brought up already. The fact that we so much under has to do with the requirements, has to do with keeping up our buildings that go older and do not meet the requirements. So a lot of that money is left spent on doing this, not necessarily on healthcare providers or certainly not on nurses. So those two things out of the way. But going back to the initial idea, I want to say clearly that doctors and the organizations that I represent, we are all very happy with the idea of creating one health district for all. We've seen many times and through many years that duplication is wasteful. There's a lot more technology that we still don't have today that couldn't be possible by either Pioneers or El Centro to bring in on their own. There's a lot of things that we need to improve on and create services. This is the very first step that we as physicians see in the right direction. Let's get all our monies in. The other thing is that I'm very optimistic. Hospitals generate a lot of money every month together. We will be able to pay off the debt. And bringing in the state, in my view, is the solution. The state has to be involved. We are a very important county for our state, not only because of the border issues. Our county is very important to the state and to the nation in production of food. Our vicinity with Mexico, we are a major port of entry with its responsibilities, cost, and medical needs. We cannot close either one of the hospitals. We need to work together. I applaud the leaders today to see clearly that this is really the answer. Stop with competition, stop with duplication of cost. Let's share all our doctors in both hospitals. The doctors support this. Doctors want to be part of the solution. We want to participate at every level that we are included. We can also have answers that may mean a lot on finding a solution. Third and last is that we are very optimistic, very happy to be here, Imperial Valley, for 27 years. There's people that have been there for longer. We need to attract new people coming in. We need to attract new doctors. The only way we're going to do that if we have a solid, healthy environment for doctors to thrive and bring in new services and take care of patients.
Thank you, Dr. Robles. During the meeting, I think there was some cards being passed out, question cards. Feel free to write your questions on that, pass them to your left and or to your right, and we will have somebody come by and pick them up, and we'll be asking some of those. And so with that in mind, I'd like to ask the panelists, especially those that have not had an opportunity to provide input, what are your thoughts or your views on should a district, general district, whether the name is whatever it turns out to be, should it be created? And I see Jeanette raising her hand first, and then we'll go to you, Doctor.
So again, my name is Jeanette, and I serve the entire community through the Public Health Department. So every little corner of this county is served, like I said, by one entity. So I'm speaking using slightly different lens, and it's great to work in unison. I can tell you that in the worst of our times during the pandemic, that was key. We needed to work as one to make sure that the services were available and accessible to every single person in this community. I do think that we really need to define what the common purpose is, what the common goals are, and understand that our healthcare system is very broad and intertwined. Health is everywhere. We also need to understand that, yes, healthcare, our providers play an important role in this community. I worked with both hospitals, with clinics, with pretty much almost every single provider of health in our community, and they are cornerstones for the health and well-being of the individuals and the communities we serve. There are two key pieces, and I think, Dr. Robles, you touched on them maybe just a bit. The state and federal government do need to be involved, and we talked about the regulatory pieces and those barriers that are imposed on our systems, and they are costly. And we here in rural counties have to decide, is it the service to the community or is it the upgrade to the building? And we understand that in Imperial County, we are underserved in many different ways, and sometimes we're not looked at using a health equity lens. And I think our state, federal, we really need to engage in those conversations. And also talk about the Medicaid, the Medicare, Medi-Cal reimbursement rates and what that means for Imperial County and what options do we have as a rural community trying to make ends meet. At the end of the day, again, I truly think coming together, using a collective approach, unified approach, it is the best. Not for us, because all we do is ultimately for the citizen, the person, that lives in this community. Thank you.
Thank you, Jeanette. Doctor?
Thank you, county supervisors and city council member, ladies and gentlemen. Thank you for all this. I think we are in a big crisis, as you can see and hear, and we've been hearing about this for a long time when we sit and learn about our hospital finances. We are in a situation where most of the hospitals in the nation who are in rural areas are suffering from. You open today's CNN Business News and you look at a lot of rural hospitals are closing because of increased operational cost, wages, and lack of healthcare workers, from nursing to doctors to other healthcare professionals. What we hear is what we've been trying to hear for a long period of time. I think we are in a severe crisis. If we don't act now, we don't know whether we're going to be sitting here talking about the hospital. Mr. Oliva and Ms. Santillan, I think what you proposed, it's wonderful. The main issue is getting a legislation to get one health district is going to take a long time. We are in a dire need to act now. So we definitely going to need the help of the local official and the state official to get this going. Otherwise, we are really ending up with no hospitals in here. The story is not about just the hospital, it is about the healthcare of the community in general. Whether it is a member of the Imperial Valley or somebody passing by, which we serve most of the time. So we as a healthcare community doctors and physicians in the hospitals, we all definitely support the idea of getting one district or getting together to decrease this operational cost, but we have to do it now. Thank you.
Thank you, Doctor. Anybody else would like to chime in?
The only thing that I would say is that, I appreciate the doctors saying that they support the idea. I just want to make sure that everyone knows that as far as the legislation, I personally don't think it'll take a long time. And the reason for that is because this would be a district-specific bill, which if I were to tell you, please vote on something that Calexico wants, and you don't live in Calexico, you'll say, fine, whatever, it doesn't matter, right? So there's a sentiment amongst legislators that if you're introducing a piece of legislation that really only affects that district, it's a courtesy, right? You vote on it because that member asked for it, and it just kind of flies through because it doesn't affect your district. So I don't think, now the one thing that is latched on is whether it's ECRMC's idea, it's Pioneer's idea, it's a combination of the two. What will have to go before the voters is the tax increment, right? That's not going to just happen because we said so. It's something that will have to go on a ballot, and the community will have to vote for it. So that is probably the hook. So whether we go this route or that route or whatever, that is something to consider. So the urgency and the quickness that we have to move on would be to either put that like on a June ballot or in November so that we can get it going. So that I do want to highlight.
Thank you, Mr. Oliva. I'd like to express my gratitude to all of you because now the community is getting involved. We are in a crisis. It's something that maybe we should have done in the past, but now we're here right now, and we need to move. And I agree with Mr. Oliva. If we all go together to legislation, it will be a lot quicker. How we're going to solve this, that's where we have to start our talks and be able to agree, and Eagles put aside like it was in the past. We didn't do it. We got to do it now. And we have very good ideas on how we want to do it, but having to get into it right now will be a lot more taxing right now, but that's something that we can end up talking together. And as we come together as a community, going to legislation is more powerful than what it was between El Centro, Brawley, or Calexico. Unified and with the doctors on our side and the community, we can go ahead and do that. Like I said, we can work out the differences, but let's go to the legislation, let's go together, let's go over there and propose one district, whether it's going to be El Centros or whether it's Brawley's, we just need to get together. And hopefully that we can do it expedited, because we have one district right now together, or is it faster in creating a district? There again, we'll all have representation on this one district, do the tax assessment that we need to do, and look at what is favorable to us. What is it that El Centro can use? What is it that Brawley has that we can use right now that we don't have to duplicate and duplicate the seismic that we have in each building right now? So we have to look what is best right now without having to spend that money that we have right now or that we will get in the future, because we're all expecting monies coming in from FEMA and from other things that we have coming in right now. So that's what we need to do. And thank you very much, Dr. Robles and Dr. Sade, Dr. Vo, and everybody here today, because that's what we need to do. We have to be one community, not separate communities, one community. And that's exactly what we're doing today. Thank you.
We'll go to Dr. Robles and then Dr. Sade.
Real quick is that I am actually been thinking the citizens of El Centro and the other cities will see this clearly. We already have other cities participating in paying their tax, Calexico and Brawley. I don't see a big deal really. This is a necessity for the long term. But short term, like Dr. Aljazen was referring to, and many of you, we have to get the state involved. They need to see this as a crisis. That's a short way to resolve it, pay our debt with the private companies that loan money to the city, to the hospital, I say, and get them out of the way. Get a long-term loan to get us out of this and move forward. I think this crisis happened for many reasons and created opportunities with a lot of positives in it. And one of the major positives, I never seen the doctors so united. Number two, I never seen all of you so openly united, the city leaders. This is the way to go. Let's get going.
Thank you. And Mr. Blancato, if I can just add.
We had Dr. Sade first, and then we can go to you.
Sorry, I was just going to say that it seems like we have two different goals. So one is going to be a short-term goal, and one is going to be a long-term goal. Everybody seems to agree on getting a unified health district. Now, it's pioneers or completely separate. We need to discuss that. But short-term goals, we need to figure out what our short-term goals are, because still, as you all know, the hospital is in a dire situation. We still have El Centro Regional have money for the payroll till March. So we're going to have to figure out something short-term. Now, getting the bondholder off of city's responsibility is part of the short-term goal. Increasing the revenue cycle and bringing some money is a short-term goal. And we're all here to help out, put our ideas. Thank you.
Thank you, Doctor. Go ahead.
Yeah, I was going to add, and I agree with all the ideas and things that we could do. Speaking from my expertise in operations and clinical, some of the things I'm thinking also, this is not only a hospital problem, right? We also have to involve the clinics, which I'm assuming the clinics will also become one district clinics. But some of the things we can do from the outside to support the situation will be, I've been thinking creating nurse navigators. In other words, when the patients are discharged from the hospital, many of them come back because there's nobody at home to really manage their care. They're confused, they're elderly, and when they don't have the family around to support them, they end up coming back. I work in the ER in El Centro for 10 years. I work at Pioneers ICU for 6 years. So I've seen both sides of the both hospitals. I will be glad to participate and discuss how can we reduce the length of stays in hospitals. What's the goal and to decrease cost. Also, how do we reduce rehospitalizations? There's no point in having somebody with diabetes, taking care of them and discharging home stable, to haven't seen come back in 2 weeks because they couldn't afford the medications, they had no family members to care for them, etc. Talking about how to reduce waste and abuse. Also, we know we are an underserved rural community. We need physicians, we need nurses. I don't know if the public knows, but we have a shortage of 1 million nurses in the United States. and we're not producing them fast enough. I was a professor of nursing here at IBC. We were graduating about 20 nurses per semester. That's not going to help us, catch up to the needs out there. We heard from Mr. Oliva in your press conference that the cost that it was to get registered nurses to come to the community to support during COVID, over millions of dollars. I think also it will be important to discuss if we could unite as a district the creation of urgent centers. A lot of these patients that go to the ER, they really don't need to be in the ER. They're basic. I work in the ER for 10 years, so I have a very first-hand understanding of that. So I think that will be something that our community will be very blessed to have urgent centers in strategic locations to care for that sector of the community. And those are some of the things I think we can also continue in the discussions, in the short-term goals, long-term goals, and in the middle.
Thank you. Go ahead.
I wanted to ditto what the doctor was saying about that we have short and long-term goals. I think we need to focus on the short goal that we have here, which is the emergency with El Centro Regional Hospital. And I think at this point in time that Pioneers, Hefferman, and El Centro need to get together to see how we can solve the problem with the issues of the monies that are needed. And I believe that we all are on the same train. I believe that we all want the same goal, that we all want the best for our community and for everyone that lives here. We don't want to lose lives because we don't have the facility to take care of them. So I believe that that should be our next meeting or get together. We're going to need a commitment from everybody on this table. We're going to have to not just meet today, but meet once a week until we can solve this problem, because March is just around the corner and we need to do something before that date. Thank you.
Mr. Kelly, go ahead, Supervisor.
Thank you, Mr. Plancarte. So it was framed perfectly by Dr. Robles that there is a long-term agreement that I think we are all saying a unified countywide health district is the path for long-term, and it will take time. The immediate need and how do we get there. So I know that the time is very short, and we will be speaking with our representatives in Sacramento and in Washington about where those resources and what can be done. But I also put this in front of everyone about paths, right? So is there the opportunity to be able to give some stability into the system and talk about restructuring of the debt through bankruptcy to be able to hold the debt at abeyance and allow us the time to be able to address these things that we're talking about now and to find the monies in concert, not El Centro Regional alone, but with the support of this group and others.
So some of the questions that have coming in relate to different groups. All the questions that relate as to how PMH specifically does anything related to their daily business practices or their employment practices or El Centro Regional, I'll tell you right now, if you wrote one of those questions, I'm going to recommend you go to them. This is probably not the forum for those agency-specific questions. There's a lot of questions that are coming in that I think I can ask the question, but I can also streamline some of the process by summarizing some of those. Have to do a lot with how would this district be formed? Why a sales tax or versus a property tax? Why this district versus that district? And I believe is LAFCO part of this, the Local Agency Formation Commission? And I think those are all questions that will not be able to be answered today, but are part of a work group that will have to move through that to figure out what the answers to that are. One of the questions, and I think I probably know the answer, but I better ask, is what is the plan for the clinics as it relates to the hospitals in its continued operation. If anybody would like to chime in on that.
I actually have not heard from our local board, ECRMC. Our clinics operate on those two cities. I'm not sure that actually the clinics are the key question. The clinics are currently contributing to ECRMC significantly. A couple of years ago, our clinics became actually the source of more revenue to the hospital, to ECRMC. I'm talking about outpatient clinics, ECRMC, of what I'm chair. And the clinics need help as well. We need more specialists, more resources to continue to provide the service and also to contribute monies to ECRMC. So I'm not certain that the clinics necessarily are part of the solution. The clinics, both for Pioneers and El Centro, should be allowed to continue to work day to day and do their part.
So I agree with you, Dr. Robles. They are very important contributor to the bottom line. Mr. Oliva can correct me. But we know in Calexico, the two clinics sitting in front of each other. So if that will be one clinic, maybe you can save on the nursing staff and the doctors.
Definitely.
The whole district will benefit.
Right.
No question.
Sorry, the only thing that I would like to point out is to make sure that when we unify the district, those two clinics stays as a rural health clinic and keep their status as a rural health clinic. We just need to make sure of that because a few years ago, I think we had some issues when moved the clinic to the 4th Street over here. We were almost going to lose that status. So we need to make sure that we still, whatever you guys decide to do, keep in mind.
Ms. Santillán?
You know, the clinics are doing wonderful. And like you said, they bring the bottom dollar to our hospital. So we will not touch it. There again, if we unite, all of these things will be united. And we can work together on it. And it just doesn't help, you know, just our rural health clinics we have. Remember, Intercare is in there. That's one of the biggest clinics. They're all doing great. It's just the hospitals right now that we really need to work on. And these are details that we're going to have to work, just like Mr. Ramirez brought up regarding the outpatient, the inpatient that we have. All of that's going to have to be united, and those are the details that we're going to have to get into. So
Yeah, I endorse that comment. Yeah, the most expensive of all the operations in healthcare is hospital. So the clinics, whatever it is, but I definitely see your point, Sylvia, that if they're competing and they represent cost for the same population, we probably should unite them, no question, just like we will do with everything else.
Dr. Vo?
Yes, I have some suggestion for that. Clinics for the hospital and the private clinics. Also, I think the hospital should partner with the private office to work together. Because really, I mean, the hospital clinic, that's rural health clinic. So the reimbursement is much higher than private, like my office. So we can take advantage of that. I think the hospital should let us to partner and help and see more patients at outpatient clinic. I think that's the future for us because, again, Medi-Cal patients, I see Medi-Cal patient reimbursement by $30. So that's not, but the hospital reimbursement about 100 or more. So that's why the private clinics should partner with the hospital, make a uniform, expand more rural health clinic because we're in a rural area. So that's financial advantage we can take. I think the hospital doing good because of the reimbursement, right? So we can do that together. And for the short term, I want to mention a little bit about the short term, if it's okay with you.
Yes, and then we'll go to Mr. Oliva, and then we'll come back to Dr. Robles.
Okay, so for short term, I think right now the death is the issue. So private equity can come in if they can purchase that. I think that is one the good solution. Or we can get the loans like Mr. Olivia said from the state, the federal. We can get that. We can solve that problem, and then we can combine to a super district hospital. And again, for short term, I think if Mr. Oliva here and the whole city council here, we would like the provider to be part of the board, the ECMC board, so we can see the business side and the clinical side. Because really now we miss that. Because for me, I can see, for example, I can go and talk to pharmacy hospital pharmacy, okay, which medications cost me a lot of money for the hospital. And then we can educate that to the doctors and make sure that we minimize the supplies. I think that's the key. So we come in, we can adjust those things. Hopefully we can minimize all, of course, all the contract, like with all the vendors, we can negotiate. Of course, with the bondholders, Mr. Philip right here, we can help to negotiate that contract so we can have an idea how much we have to pay off the bond. So those are issues, I think. And very important right now, I think it's urgent for the whole community here is talk about OB and pediatrics for El Centro. And that's another option we can see what we can do to help hospital pays. That's urgent. Hospital pays, I think that's very urgent right now because really nobody wants to transfer all Calexico to Pioneer because it's the risk. For example, you have a stroke patient, you can wait 3 hours. That's the timeline we have to treat right away. So those are things that we already addressed. But I think hopefully after this meeting, Mr. Oliva and the board of El Centro Hospital let us have a voice in the meeting so we can sit down and go into the hospital and talk to more detail what department we should expand and what department we should slow down for right now solution. I think that's the key because really we running out of money, we're running out of resources. Long term we have already. Now short term, yes, we have to focus and really work. And another thing that we need to have, the community champion doctors in the valley, bring the trust to the valley again, bring the trust to the El Centro Hospital again. I think we don't have the trust from the community right now. And I think that's very important because why patients have more OB/GYN service in Pioneer versus in El Centro. So those are the questions that really we need to redo or do something better because we have the patients here, but most patients go to San Diego for services, and that's we lose a lot of money for the valley. Medicare pay almost $500 million for the Medicare patient in our county, and we don't take advantage of that. We just send everybody to Indio, Yuma, San Diego, and then we just take Medicare patient in the hospital, Medi-Cal patient in the hospital, and the reimbursement is not high. And we would like the county, the city, and the public health discuss this with the state because really, why Orange County, the Medi-Cal rate is higher than us, and Medicare rate higher in San Diego than us. We are rural health, and we don't have enough doctors. We have to pay double their salary over there to get the doctor to come here, and that's the key. And of course, we hope after today we have a good, solid solutions. And we all here want to be involved with the El Centro Hospital for the urgent matter, and we can have a solution for all of us to move forward.
Thank you. Mr. Oliva?
All right. So I want to be very clear about something. So if I just allowed for what was just said to just kind of echo in the room, and there was a lot of statements there that I want to clarify. And when statements are made as far as like there's not enough trust and this and that, if I were to stay quiet, that certainly is the case. But let me just clarify on some things. Mr. Vo mentioned about the bondholders, then he pointed to Scott Phillips. Scott Phillips does not represent the bondholders at all, right? He's the CEO of the hospital, and he represents an auditing firm that brought to light a lot of the things that were behind the table. As far as the request of bringing medical professionals on the board, they have always been part of the board of trustees. There's the chief medical officer is on the board, right? There's a physician that is elected by all of the physicians at ECRMC that sits on the board. So it's not a bunch of politicians on the board of trustees. We have medical professionals that are on the board already, right? It may not be necessarily a private practicing physician that is asking to sit on the board now, but they are representatives, medical professionals that sit on the board. So again, this trust is because people are saying stuff that have a little wrinkles in there, so I want to make sure to iron that out. Going back to the clinics I think will continue to operate, right? I think if anything, the unification of the district would be better for Calexico, because rather than having outpatient clinics that try to compete for patients and whatnot, we would have a unified set of clinics, right, that would service They can complement one another, right? And just to kind of give you some context about why we have to, the rural healthcare designation has a lot to do with the census tract. So basically, the federal government will identify certain areas as rather being rural or metropolitan, right? And so El Centro and Calexico are no longer considered rural, right? They're considered metropolitan because of our population size. And that's probably one of the reasons why if you buy a home, you can qualify for a USDA loan in Brawley and Imperial because they're still designated rural, but they don't offer that in Calexico and El Centro because we're not designated rural. So why is that important? The outpatient clinics in Calexico and the outpatient clinic in El Centro are designated rural healthcare clinics, right? If we were to move them, if we were to change them, we would lose that designation, right? Yes. I believe Pioneers had an issue with that. They were trying to move to a new building, and they couldn't. This was like several years ago, and it was mainly because Health and Human Services, the federal department, would not allow them to transfer into a new building without losing that whole thing. So the federal government is going to need to assist us in terms of that, right, to make sure that we don't lose those designations. And if we come under one home, right, one district, I think it would enhance the services for the South End. So I think the clinics, I think we all agree that those should continue, absolutely. They're great commodities to the system.
I agree, absolutely. Yeah, those are little details that we probably need to sit down and work on, just as many others. Mm-hmm.
Sorry, I believe, continuing your conversation, yes, I understand that Mr. Phillips doesn't work for the bondholders, but he has as he put it, has a lot of experience. 22, he said that he'd done that at 22 different hospitals, so I'm sure his experience will help us negotiate with the bondholders, or at least give us some guidance. And one of the other short-term goals that I would like to discuss is that we closed the OB and the PEDS department, very abruptly, and we have a very limited time to request for that certification to be pulled back. Otherwise, we will not be able to recertify again. Even if we are planning to downsize, I would plead to consider that strongly, to bring the certification back and either restructure the OB and PEDS to be a smaller department, or just be able to perform surgeries, because that reduced the number of surgeries that we've done in the El Centro Regional Department. And we can bring that money back by performing C-sections. Right now, by doing all those C-sections at Pioneers, it put a lot of stretch on our staffing at Pioneers, but we can potentially consider that. So if you would consider pulling back from the CDHP, the request that you sent to close the department, that will be a short-term goal. Thank you.
And I think that's more part of a work group that you'll have to work with the institution itself. The questions that continue to come in relate to how a potential district would be formed. Okay, and so that is not being decided today. That's an idea being suggested. There will be a work group. I've also had 3 questions asking, will there be ability for public to be involved in these work groups? There will. There's no question about it. That is the way it will be. And Ryan, myself, the entire board, I'm sure everybody up here is committed to it. That is the way it has to be. If we as a community are to foster the formation of any kind of district, it has to be as a community. It can't be in a small group. So I know I'm ad-libbing myself, but it's a type of questions I see. There are questions coming around, continue to come in related to specific operations of each organization that are not part of this. And so once again, I'll refer those after this event to those specific organizations. Ryan?
So I understand, Dr. Zadeh, the wish to reestablish the OB and pediatrics, and that is a choice that has already been made, and I know that it can be reconsidered, but that would add more fuel to the fire at the moment. So I do want to stay focused on the future of how we can stabilize, and Dr. Robles brought this question, and I do think that that's something we need to talk about, is on the immediate path, what are we going to do? So I pose the question, and I know, and Tomas, you're, and I appreciate and I love that you're here and you're willing to be that focal point. But if there's a willingness to join with you to be able to go through a structure of being able to have given us the allowance of time to be able to have more meaningful discussions about how the debt is resolved and put those creditors at bay so that we can keep operations operating in El Centro, and that we can come to this idea, this grand plan that we've been discussing today.
Yes, no, I'm thinking to myself, I don't know why what you just said sounded so cryptic, but it's not, right? Why don't you just say it, right? I certainly, I think that...
I didn't want to step on anybody's toes.
Oh, okay. I was trying to figure out why
on Tuesday I upset somebody by making just a jest about IAD, but I didn't mean it in any insult, so I'm trying to cover myself with the words I say.
I just saw you tiptoeing so bad on that one. Why do you got to do that? So, yeah, no, absolutely. I think the conversation of how we get to, I think one thing's for sure, we all agree what the final destination is, right? And we will have to sit down formally to figure out, the ins and outs of all that kind of stuff, which we haven't, but we've at least agreed and we've met informally to agree the path, right? More or less the heading that we should go. So, making the omelet, as you could say, we just need to sit down formally and just kind of figure it out.
Okay, and so you're open to that conversation about that going into bankruptcy protection for reorganization and being able to keep the creditor at bay and operations continuing.
So no one said anything about bankruptcy, but I will tell you that I'm willing to sit down and figure out what will be said, and keep in mind this is not the Tomas Oliva show, right? So I do have board members that I will sit down with and figure that stuff out.
Sure.
We will talk about what
There's
we're all
no
willing
commitment.
to do, right?
I was just asking for your openness to that conversation.
Sure, we sit down and figure that
now,
out. Yes.
Dr. Kathleen Lang, you represent the largest provider of Medi-Cal recipients, and your parent company is a very influential broker in California and in health services. What part can California Health and Wellness and Centene play in making this more of a possibility?
You are correct. In California, we are the largest Medicaid provider. In fact, nationwide, we are the largest Medicaid provider, or of all government insurance, so Medicare, Medicaid, military, et cetera. We are open and interested in learning what our role here can be. A lot of the reason for me being here today is to listen and learn and see what the specific issues are from hospital leadership and from local physicians. Having said that, we are having internal discussions with our California executive leadership to see what we can do to help support the local hospitals. It's a nationwide issue with rural hospitals, but quite frankly, my concern is Imperial County. This is my region, and this is my home, and this is the place that I want to put resources if resources are available. So I don't have a specific answer today, but I do want to say that the plan, we're meeting next week internally to see what we can do in the short term to help one or either or both hospitals to be able to continue having their doors open. It doesn't take anyone by surprise that our main concern is our 80+ thousand members, keeping them healthy, timely access to care, quality care. Cost savings comes into that. But those are our motivating factors. I do want to say also that it is not just the hospital system, but is the entire healthcare landscape that is important. And so we look at all pieces of that. And how do we keep our members healthy so that they don't need to present at the hospital? So the right level of care at the right time in order to serve our members in the best way possible. But recognizing the crisis that's going on now, it's important for us to offer support and identify a role as to what that support would look like. And we're having those internal discussions now, and I hope to have some more specific answers after we have our internal meetings next week.
It is fortunate that your structure, your leadership structure, allowed you to join us today.
Yes.
And I hope that that continues as we have further conversations.
Yes, we would like to remain at the table if possible, recognizing the number of constituents that we have here locally.
Thank you. Mr. Walls, this is a periphery issue, but it does need to be addressed, and that is about the pre-hospital service in Imperial County. A couple of things that maybe everyone is not aware of is that AMR is a private service that has an exclusive operating area in Imperial County. They provide services from Calexico to Riverside County, and we do, in the base hospital discussion, the base hospital designates the appropriate receiving facility. So that could be Pioneers, or it could be El Centro, or it could be a facility that has a more definitive care out of county through airship, or if it were close to a border in Riverside or in Yuma. But another piece of this is also in Calexico, where for multiple years in the pre-hospital setting, AMR has been backing up the city services of Calexico Fire. And I can see that Cedric's probably cringing at the moment, because you can remember that. So there are needs there too. How do we incorporate pre-hospital into all of this conversation about a countywide health system or a health district? Mr. Wallace.
I think it's important to ensure that pre-hospital is represented at every level, and so I'm hoping that is, sorry, I do hope that is my role on this committee. Pre-hospital, if I could just address the base hospital component, the base hospital does not dictate destination. What the base hospital does is provide us medical direction on certain protocols, not all, whenever we are in an intense situation or we have a very critical patient which we need to administer certain medications or we need to do some form of an invasive procedure. About 95% of our operating protocols are all standing order. Very few are base hospital order or require an MICN or a physician. So I think from the pre-hospital perspective, I can't speak for all agencies, but for us, we want to ensure that we have a base hospital, whether it's Pioneers or whether it's El Centro or whether it's both hospitals. I don't think that matters to us. What's important to us is when we need to pick up the phone and call for help, that someone's going to answer the phone in a timely fashion. They're going to provide us the expert care or expert guidance that we're expecting them to, and they understand the situation in which we are in. Now, there is extensive courses that is provided to the physicians and also the MICNs, the mobile intensive care nurses, so they understand what the pre-hospital world is operating in. And we're actively involved in that, and we will continue to hold those classes to ensure that there's no gaps in the base hospital compartment, whether it's El Centro or Pioneers. We cover a very, very large geographic area. Imperial County is very rural. I know really the focus today is really about El Centro and Brawley and Calexico, but we also have to remember that we have Westmoreland, we have Salton City, we have Winter Haven, we have Ocotillo, we have Palo Verde, which is a small little community that they don't get a lot of love from Imperial County. Let's face it, they're out there. Response times are long. We had to come up with a mitigation plan to ensure that they're served, and we will continue to do that. But one thing too that a lot of people don't understand is during the winter months, for example, Thanksgiving weekend, we're impacted by 200,000 riders out in Glamis. That surges our system. It makes everyone's life hard, and it clogs both hospitals. It stresses resources, and we get no support from anyone. Whether it's AMR, whether it was Gold Cross, there's zero support. The fire departments don't respond out there. That's something that has to be addressed as a part of this in the pre-hospital world. We continuously get surged on the east side and the west side, whether it's the Ocotillo area, Ocotillo Wells, or whether it's Glamis. And that's something we have to recognize, we have to address. At some point, there could be up to 400,000 extra citizens in this county recreating in the recreational area.
That's a very good point. Hey, I'll come to you in a second, Dr. Robles, but what Brandon just touched on is something I think we're all aware of, is the outward migration of our patients. And some of those patients don't have zip codes in Imperial County. A lot of them have full insurance with the $250,000 worth of toys that they go to in Glamis and in Ocotillo Wells. Those people haven't been coming to our facilities by air or ground in the numbers that we saw in the 2000s. And that's because they've been either directly, either from rotor wing or directly from field transport. They've been going to initially Desert Regional and then to UCSD and to Scripps, Palomar, Pomerado. Yeah, so now we need to capture that. That's something that we used to have trailers out there sponsored by El Centro Regional, to have a field triage unit on site in Glamis. Pioneers used to have the same thing at the ranger station on Gecko. So I know it's been discussed, and it is something we have to capture and change, because the outward migration, not just of our population, but those visitors that are coming here, we're not seeing them come through. Dr. Robles.
Yeah, just a quick comment that we need to redo those clinics now in conjunction with the Imperial County Health District. We will be much easier to do that again. Have the clinics when the tourist peak time over in Glamis. So 90% of the patients don't need to be transported back to either hospital, and have a joint venture, joint effort to cover those needs. Number one. Number two, the hospital base, we heard from Mr. Phillips an approximate cost. It's actually expensive to have that service. And as Mr. Wells was mentioning, it's not an issue with El Centro. Why is the county not exploring other ways to cover that cost, that service countywide? Why is the city of El Centro has to carry that cost for 30 plus years? Mr. Olivas, perhaps you have a reference, but El Centro has done it for many, many years. And these are times where funds are short. We need to explore other ways to subsidize that cost. Why is ECRMC has to pay that? So look for other sources of income to cover that cost. Pretty simple.
So let me change that question a little bit. The question should be, has Imperial County researched ways to incur or help this cost? And that would go to Jeanette.
Yeah, that's my question, yes.
So absolutely, yes, we have researched ways. We have looked at what other counties do. And actually, some counties charge to hold that status. So it is not uncommon to see that the EMS agency actually charges a hospital. Not saying that that's what we would do in Imperial County. We've never done that. We have looked at other scenarios. We've worked with both hospitals, in contact with the CNO from El Centro Regional, and as mentioned to physicians on Wednesday, that we're looking forward to having a joint meeting where everyone's at the table to explore the different possibilities and options for Imperial County. And if, like Brandon just said, if it's one, great. If it's two base hospitals, great. We're also looking at policies, because the EMS agencies does set policy. We're looking at training. We're looking at different possibilities for Imperial County. So that has been an ongoing discussion, and it will continue because, like today, it's not something that can be solved from one day to the next. But conversation is happening.
So on happening conversations, for those of you that registered via email, which everybody pretty much had to, following this meeting, you will get an email to that account with a link to the video, to the documents that are being provided, and the pictures that are being provided. For those of you that haven't registered, I suggest that if you register even after the fact, you'll continue to get the updates. And if you go to imperialcounty.org, on the main page there will be a flag flying through that says Future of Healthcare in Imperial County Roundtable Discussion. Right now it says register here, but as soon as the video is uploaded and the documents are uploaded, that banner, that register here, will have a title such as event information or something to that effect, where you can get that information. So that's imperialcounty.org, and then you'll see the banner on the landing page. You will also get an email to the email account with which you registered.
So,
Ryan, if I could just add a comment real quickly.
Carlos.
And it's a great idea what you're mentioning. I work in both hospitals and critical care about during especially the GLAMI season that we call, right? How come all those trauma patients are not coming to our hospitals, or all of them? And I just want to kind of make the community aware, because we don't have the resources. I don't speak for the hospitals, I'm just thinking, we don't have neurosurgery available all the time, orthopedic doctors available. So a lot of these trauma patients fall into a different category that our facilities will patch them up and get them stable, but they will have to eventually be transferred, which is another way we're discussing that we're losing a lot of that revenue that could help the hospitals because it's going away, but that's usually because of the lack of resources. Sometimes it's lack of staff, as we had seen, but mainly it's having neurosurgery, thoracic surgery, all these critical cases that, fortunately, we're not a big hospital with a trauma, floor that we will take care of this patient. That's just a comment I wanted to mention.
Carlos, you're touching on exactly how it could be to our benefit and the community's benefit is we're both hospitals are trying to do ortho and neuro, and it's not consistent, right? But if it were a countywide system, they would be able to choose that we will have coverage for ortho, and that isolated femur fracture will come to
us,
and that thoracic blunt trauma will come to, rather than seeing that fly over us.
Yes.
No offense. Reach took me for a ride, and I thank them because I'm still here talking and walking. Dr. Al-Jazim.
So just to continue that conversation about we don't have these resources, I think just a reminder to all of us, including the county and city leaders who are sitting here, that yes, the short-term goal is we're trying to save ourselves and the healthcare in the Imperial County, but we have to remember the long-term goal would be to get funds and resources and capital to the health care in the valley, and the capital has to come when there is policies, taxes, whatever it takes, because we have to look at the future of the survivability of healthcare in the county. Thank you.
Thank you, Dr. Al-Jazim. Tomas, or Katie?
Go ahead. I just, I'm sorry, just so you can kind of get a sense of how I think and how my mind works. When Dr. Robles was talking about the base station and he said, why doesn't somebody else pay for it? In my mind, I was like, ding, ding, yeah, right? Why isn't somebody else picking up the tab, right? I wanted to just like wipe off the sweat off him and just kind of go like, throw another chingazo, right? But absolutely, I think that, we're willing to do our part, but certainly this is a regional effort in terms of the home base station, and so we do feel that somebody should assist in terms of that, but I want to make something very clear, and that is a lot of the discussion that we're touching on as to whether or not there's neuroscience and whatnot, I think I speak for all of the board members when I say that will be for the future governing body of the healthcare district that is to be created, that they will discuss that, and that they will, because at that point, if we're successful, the current board of trustees at El Centro Regional will go back to being city council members, where we will focus completely on, municipal issues, and we will be then handing over the keys to this new governing body. And so I think whatever that looks like in the future, that's what that body is going to have to deliberate on.
I understand, and I think it's more about recognizing the possibilities right now at the moment. Ms. Santillan.
Going back and doing it short and sweet is, number one, we have to get together and decide what we're going to do. Form one district. How are we going to do it? Second, once it's formed and we can move forward, then we can go into all the details that we're talking right now about. That's why I would say it's a taxing effort when it comes into the second. But first, we've got to get to the first. And it's great that all of this panel is going and putting in their information that we need to take care of. And we all know that. But we're just trying to let the public also know every little thing that happens in our hospital, because a lot of people may say, just like some of you had said, how come you don't take care of them in this hospital or in that hospital? It's because we just don't have the specialty. That's what we need to do. So, putting aside our differences, both hospitals, and actually Calexico also, and I look at Sylvia, we need to put our financials ahead. We need to put them on the table. Look at the resources. What is going to be best for the community for us to do? What resources can we pull from each one of them to make it the best? Forget about our egos at this point. It's about lives that we have to carry about. And it's the lives here, yours and mine and our kids and everybody else in here. That's what we have to talk about. All of this can come in another forum or in a committee there, but we got to figure out, we got to get to first base before we get to second. So, I really appreciate that everybody's putting in their input, the questions that they have, but right now we got to get to first base. That's what we need to do.
So that's the perfect segue. And what Sylvia brought up about an hour ago is, where do we go from today? So now we're in a wrap-up. We're going to try and come up with tasks that we can agree on, and then when are we going to do this again? How quickly? Is it going to be within the week, or is it going to be a week? And who else is going to be invited? Do we break into other groups to have, and who? So I'm listening to all of you of how do we take this forward?
So I believe, and maybe Brandon, you may agree with me on this. We have different situations, and one of them, shortest term, is also the base hospital situation. There's already a group meeting, and it does include, well, I'll take that back. This past week, we talked about a joint meeting, and that's being worked on, where the different parties come together and agree on what the next step is. I know we've been in conversations with PMH, talks about agreements. There's been decisions by their board. Just yesterday, we received the hand-delivered notice of El Centro Regional rescinding the letter that was sent to me on delivered to me on December 27th. The first call I received was from the CNO on December 22nd about that. So they want to have that conversation, but I explained to both hospitals that it needs to be joint. So that group is pretty set. We'll determine if there needs to be transitions, if there needs to be a new base station, and again, just move forward and ensure that there's no interruption or gap in service. So that's a section of this entire conversation, and Brandon, I would think you would agree, because you are a big player that you also need to take part in that conversation.
Absolutely, and I am a part of those conversations, and we will not lose our base hospital status regardless. And like I said, in the emergency setting, don't be scared. And the other thing I would suggest that if you do have a concern, you have a question, Imperial County EMS is there to answer your questions. Don't be afraid to reach out. You have my contact information, you can reach out to me. We will get you the right answer. So please, let's have faith that things are going to be fine, because we're going to assure that it's going to be okay.
And absolutely, there's a cost to everything we do, and those are also part of our conversations. And again, it'll take a united front to take care of this.
Thank you. So, base hospital, that conversation is already set, and that the stability of our pre-hospital setting is going to be addressed, and the community should be secure in knowing it's not going to be lapsed. Okay. Then the other big one is, as we talked earlier about everyone in agreement of a countywide health district and pursuing that, and it also plays in the short term and long term. I believe that our path is that we need to get into a conversation with the LAFCO executive director, that El Centro Regional be represented as the city, that Pioneers be represented as the district, that Heffernan be represented as the district, and start running through the timelines of process. Because regardless of state action, LAFCO is going to be involved. Regardless if you want to create one or you want to expand one, you have to go through that process. And if that timeline can be shortened, it would be better to know now. So are you in agreement that that could happen maybe in 7 days' time?
What I do think is that what needs to happen from here, the takeaway, is that the three districts need to sit down either in closed session or open session to figure out what is it that we are going to agree on, right? The key points, whatnot, that we eventually will have to then take back to our boards and get approval, because then everything that you just said would need to come into play right away. So the three of us, again, it's
Absolutely.
we get to sit here, right? But we do have to go back to our boards and get approval and go through that. So that adds another little layer to it. But certainly, figure out what we're all going to agree to, take back to our boards, get it approved, and then come back and have the conversations with LAFCO.
Absolutely. And it's unfortunate that Mr. Huberger's not here today, or maybe he is. No? But I would hope that not waiting for your next scheduled meeting, that maybe in this week you have a sit down with Mr. Huberger so that he's able to share with you process and time that you can share with your boards as well. Ms. Bernal.
I wanted to say that as a Heffernan board members, any monies that we give out first have to be approved by LAFCO. So what you're saying, that we need to get a hold of LAFCO and we need to find out where we stand before we can even make any type of a decision, because if LAFCO says no.
Right. But you'll also be able to talk to your boards and be able to share the response from LAFCO of what can be done and how quickly.
Ryan, would it make sense to form a committee that meets, you were mentioning weekly, I know everybody has schedules, right? But because of the urgency, I think it makes sense to form a committee with the most important members to at least have that continuity and have a weekly update or whatever needs to happen. versus we'll get together, we need to, yeah, but when? When do we start? Let's set
Right.
a date. I think that's important at this point.
So, and I understand that and I agree. So, is it all of this group, and do we invite others, and do we have it in this setting, or do we have it in a less formal setting?
Well, those are the details that maybe this group can decide. I think instead of.
Could we first, as the three districts, meet, and then once we have some type of an answer,
Invite people.
then we can come back and have the whole panel that's here meet, because we need to get authorization.
For starters, the
from
shorter the
LAFCO.
better, I think.
Yeah, because next
Yeah.
week, it's already February, and March is just around the corner.
As soon as you agree on a platform, please remember that doctors want to be involved. All the different organizations that we have, we want to be part of the solution. We can contribute, we can help you in very good faith and with the interest of the public first.
It's important. I agree, Dr. Robles, that we all have the same information and that it is being shared with the community in such a manner that they understand. Because sometimes we get so tied up using our own jargon that the community has no idea. Sometimes I've had my own relatives call me and say, "What did you just say?" Can you explain that to me in other terms? So again, limiting maybe the more clinical, and we try to do that at the EMS agency. Sometimes we're not successful, but again, just keeping in mind that not everybody's a doctor, not everybody understands the hospital language, our language, et cetera.
Mr. Blancarte?
So when the three of you meet, I think that it's of vital importance that at least outside of the room, to be able to bring in to give you or answer any questions that you may have, is the county elections department, okay? Because if you're looking at the possibility of doing something, whether it's a property tax, whether it's a sales tax, whether it's any other avenue, there are dates, there are thresholds, there are notices, there are requirements that just our elections department sitting outside and coming in and clarifying any questions you may have will be a great tool, and we will save from having to meet a week later to have them there. Okay, so let's expedite this process.
And just within all this conversation about a countywide health district, if that's the path that is going to develop further through LAFCO, there are public hearings, there's public notices, there are opportunities for everyone to get comment involved in that discussion. Dr. Algezine.
Just one thing is, it's great to have the support of the county and the different cities. I don't know whether you know if there is any support coming from higher up, from the state. The representative, Dr. Raul Ruiz, was talking in an interview about getting some of the tax for the lithium to the Imperial Valley. Do you want to comment on that?
Because I did not see that interview, I don't know the context of it, but it's definitely something that, you know, I know there's representatives here. I can tell you that personally, I've contacted representatives at the state level and at the federal level, only to hear the answer, "Oh, I just got off the phone with Ryan, what do you want," right? And so we're making those phone calls. They know, they are aware, and everybody's getting involved at different levels. Thank you.
I can tell you that the lithium money there's no checks coming in yet, so. Dr. Zade.
There's no checks coming in, but there's a lot of people lining up in front of it.
So just two suggestions that came to my mind was that when I look across this whole room, I see a representative of, you know, California Health and Wellness, Dr. Vo, ICPMG, Premier Group. The only ones that I don't see in the room is Clinicus, and they hold Intercare. They hold a lot of numbers of patients. So I know they were invited, but I just wanted to ask to make sure that they are pushed to come in because they are a vital part. Secondly, on going on Mr. Olivas's, I think they have a lot on their board as a local politicians and city council. They have a lot on their plate to discuss. So I would like to suggest if we can start an immediate structure or restructure on the board of the hospital, so they can have healthcare providers in there, and we can delineate some of the responsibilities of the hospitals. They will still get report, but at least they're not involved at both sides.
Doctor, you're absolutely right, and I recognize that as all the pressures that Mr. Olivas and El Centro are having to deal with daily, right? And so if you don't mind, if the three of you don't mind, I'll schedule the meeting with Mr. Huberger and invite you all there and make sure it works on the right timeline. And if you don't mind, I'll join you.
No, that'd be great. And FYI, we have decided that
A
we're
little
going to...
pause there, Mr. Oliva.
It's just inner dialogue here. It's just, I know you on a personal level, and then there's this, right? So I'm just, a part of me is just thinking, like, anybody else you want to bring along? Right? It's supposed to be the three of, no, just so you know, we already agreed, we already have a scheduled meeting plan already set for the three of us.
Okay.
So we're going to move forward on that.
On Tuesday at 5. Yeah.
Okay, excellent.
But I also wanted to just echo and reassure everyone here that as far as like our leadership above in terms of the state and federal government, that is happening, right? We have even representatives in this room from State Senator Steve Padilla. That's about 1, 2, 3, 4 rows back. I know Assemblymember Garcia's staff is well aware of the situation. They're the ones that are helping us in having language, right, legislative language, assuming that that is the route that we go, right? It's ready to roll if we want to roll it, right? Yesterday I met with U.S. Senator Alex Padilla's office, and I do know that Congressman Dr. Raul Reese's office's staff is also very aware of the situation.
I think so.
They just so happen to have somebody on the inside that knows. And, and so our leaders are aware of, and they're just waiting for us to decide where we go with this so that they know how to help us best.
Okay. Then at this point, I would like to bring this to...
Ryan, I'm sorry.
Oh, Sylvia, yes.
Just one last comment. If any of you here know the board that sits on LAFCO, it would be nice if you could, I don't want to say the word lobby, but I already said it. Because ultimate, they are the ones that will tell us if we can or cannot use monies. Thank you.
And I'm not, for everyone in attendance, LAFCO is the Local Area Formation Commission, and they do the expansion, creation of special districts and jurisdictions of the cities and the unincorporated entitled. So they were created in the, I believe, the early 70s. And in here, there's a 5-person body with representatives from the public, cities, and the county. And they take on applications for annexation or creation of districts or expansion or their service levels. So like a special district that does certain things, they may take certain responsibilities off of their list or may add, and LAFCO reviews those plans and accepts them or denies them. But it's all locals that are, it is a local area, so they're our neighbors that are doing that. So at this point, I would like to bring it back just to go over what we've maybe accomplished today. So we did all agree that we want to go towards a countywide health district that includes representation across the county, and we have a short-term and a long-term need. That we will be following up on identifying the short term of how we can address and stabilize the situation, and then in the long term to build up the entire county and offer greater level of service. So in our short term, the hospital districts and El Centro Regional Board will get together this week. And then I am going to set up a meeting with LAFCO for you, with our county elections officer.
Just remember, anything we can do to streamline this, just count on us. Thank you. Let us know and assume that it will happen.
We're also going to be reviewing potential revenues or funding that can be accessible either through us, the state, or feds to be able to help this process. All processes. And then we also need to, are we going to get back in this setting of these principles to have another conversation to report back what we know or what we've learned?
Yes.
It's a benefit for the community because there was so much misinformation, and until I saw the press conference, from El Centro, finally, because people were asking my opinion a lot, and I have no numbers I can really tell you is this right or wrong, but to me that press conference made a big difference. But to what you were saying earlier too, a lot of people still don't understand, because I saw comments like, I'm still confused, and to me it was pretty clear, but not everybody understands healthcare as we do, so that's also another thing we need to work in our message. How can we bring it down to a more understandable level for the community?
Any suggestions on how quickly we would get back together?
We're going to have a meeting, as we said, the 3 districts on Tuesday, and maybe you can set up a meeting this week with LAFCO, and then maybe we can meet the following week with the commit, and maybe we'll have more information on where the status of where we stand.
So on a weekend or a weeknight?
Doesn't matter to me. I don't care. I don't know about the rest. I'm flexible.
A weeknight?
I'll clear my calendar whenever. I'm here.
You can always give that update, at the end of the week, just like how there is update now in El Centro Hospital, at the end of the week about the progress of what had happened, what achieved, and what you're looking forward to achieve.
Right.
So you can just give that in an email or in a press conference.
But what if you come up with a new idea, Dr. Al-Jazim, and how are we going to get it from you?
And on that note, I agree with Dr. Al-Jazim. Also, I think we need to give small bites to the community, because if you give such a big, long thing, people get confused. So I think points that are clear and moving forward, and the ones that are still undecided, just to make the understanding better for the community.
Also,
so a progress update weekly is what I'm hearing?
Joint.
Joint?
Yes.
we should create a platform. Everybody's so busy with meeting all county people and city people, and certainly, Mr. Olivas, I didn't want to leave without thanking you for all sleepless nights and time of effort, energy that you have put into this problem. We're all here to help you. And I wanted to say the county, I'm so happy to see that the county is involved in good faith and with a clear goal of resolving this matter. I'm very convinced that with all of you's talent, effort, and hard work, we will go through this. I wanted to say we should create a platform where we communicate efficiently at any time of the day, email type of thing group, so we can help. Because a lot of you may have last-minute thoughts, last-minute ideas that may make a difference.
And along with that, yes, a platform for this working group, but maybe a single platform for the entire community where the information, the messages go through all of us. We are in consensus that that is the message that needs to be sent to the community to avoid any mix-up and confusion. That is important.
Thank you. This is what we're just discussing right now, is that we will be meeting on Tuesday, and from there set the platform and dates and how we're going to move about it. So that would help us. Okay, thank you.
And for us, our providers, I think we're going to have a meeting as well to have an idea what to do with together with the county and board supervisors and the hospitals. So I think we're going to have all the providers to have a meeting together and discuss our plan as well. And again, I thank Mr. Oliva, everybody here to come here and help us. I think we're going to have a good plan and we're going to move forward. And I'm very confident that we're going to get out of this, just like a COVID pandemic. All right, guys.
So with that, I came in here hopeful, and I'm leaving with hope. So I think we'll call this session ended. We do have tasks, and we will be creating a group messaging and also a way of sharing all party concerned and content control delivery, right?
More of a communications platform where individuals, anybody from the community can understand. We post information, what's the current status, just like the video we posted yesterday on Base Station, where the community can just log in, look at the information, and get the latest. But then separately from that, yes, an internal maybe working group platform, whatever form or shape that takes, so that there's the day-to-day business that needs to be talked about.
Thank you, Jeanette. And so, Dr. Zade.
Sorry, I just want to extend the help of the California Medical Association. I've talked with Dustin Corcoran several times, who's the president of the California Medical Association in Sacramento. Of course, he has good connections up in the state. I know they're good friends with Governor. If you need any help on that side, just let me know and I'll extend.
All levers that can be pulled will be pulled. So with that and our tasks identified, I thank you all for taking a Saturday to join us, and especially to all of you for participating and sharing your comments and your ideas. We will be bringing back and we will be communicating back with the community. Thank you.
This is where the information will be available. And remember, the same email that you used to register, that is, that you will get the links to that. If you did not